they will always sing the song that we give. We failed to get money, and money will never be there. But the key solution is, let us open the borders beyond this department. DHO, welcome us to your district. Make it simple for us. This is how you only make it simple for us. Listen to us. Open the district. Help to shield the politicians. If the politician is bad, hide us under your armpit. We shall go into the district. But meanwhile, make linkages with the politician so the politician can be our friend. We should finish the day. It's so hot. We didn't prepare chicken because we are scared of diabetes. We want you to donate the money for lunch. Dr. Abel, here we have something called Poor Patient Fund. We open as students. Sometimes we are faced with a challenge of a patient who comes, is blind, is dropped by a border there, who goes back. The doctors, we have to lead the patient to where they are sleeping. Eventually, at the end of the day, we go home. But who gives this patient food? We don't know. Abel opened up something called Poor Patient Fund. He put in around 150,000, which we used, and that was the last money, because we realized the doctors were also poor patients. But the files are there, the records are there. Every time you're moving around and you feel like you want to donate, also donate to us for the poor patient. I don't know if it's by design, but for the 3 years I've been here, people with eye diseases are really poor. And it is, so it doesn't need magic to think through. Without eyes, you cannot make money. You can't trade. Without eyes, you cannot make any gainful economic activity. So, if we are going to keep on coming to you over and over for donations, if you know you've left your phone number there with the girls, we shall send you a reminder message that we receive mobile money for the Poor Patient Fund. At least the doctors can afford the meal, but for the patients, we want just to feed them. To feed them. Sometimes when I go to sister knows when she sees me with a patient, I'm going to ask for a waiver. So that one works for me somehow. But for the food, I've never gotten a waiver for the food, not even for myself. Poor Patient Fund, Poor Patient Fund, Poor Patient Fund. Dr. Abdon, in Ruchiga, how are you doing it? Abdon is some other name. So you come and tell us how Ruchiga is, how it goes in Ruchiga, how you are not going to transfer our nurse. Was very hard here, active during the refresher training. Please tell us how you're going to do it. Ladies and gentlemen, welcome Doctor from Ruchiga. He's a DHO. Thank you.
Thank you, MC. I'm Dr. Abdon Birunji, the DHO of Uganda district.
Thank you.
Yes. And a must alumnus. Very important. I grew up here, I was educated here, and this university transformed me to what I am. So I'm proud to come back home. The guest of honor, Dr. Stanley from Ministry of Health, the representative from the Office of the Vice Chancellor, the mighty Lions, my colleagues, the DHOs, the representatives of this hospital here, and all protocol observed. I want to take this opportunity to say a few words on behalf of the DHOs, and also finally I was told to invite the guest of honor to close this function. For the every time, this is the second time I'm invited to such a great event, and mainly funded by the Lions Club. And the first time I was itching to join the Lions Club for the great work I saw them do. Now, today, as I stand here, I feel there's something missing in me, because I don't know how much work you have done for this society. It's too much that we cannot pay. And those of us who are able, we should be able to join you and really work together. So, Chair, Bernard, please, it's your responsibility to make sure that I join. I pledge. Now, today I'm here with my colleagues from the district. I have the DHO of Kanungu district, our most senior, Dr. Seude. He's our father there in Kigezi, followed by Dr. Akasima Muchungus, DHO Rukunjiri. I have the DHO Ruchiga, Gilbert. I have the DHO Rwampara, Dr. Aran. I don't know if there are any other DHOs that I have not noticed. DHO Rubirizi? Good. So this is a team from the local government. Now, for the MC was talking too much about the local governments, and good enough we have our line ministry representative. You know, down there in the local government, things are not that easy. But for this project that is closing and starting, I want first of all to thank you very, very much. I know in my district there is one nurse who was trained in screening for diabetes, for I think retinopathy, diabetic retinopathy. There is a clinical officer who was trained. And I'm sure my colleagues, that happened to your districts too. That is capacity building, which we are very, very grateful of. Somehow, somebody was saying that sometimes you go there and the torch that was given is no longer functional simply because it has no cells. It's a pity, it's a shame, it's something that really shouldn't be coming up, but those are realities down there. Like the MC was saying, we thought diabetes was a disease of the cities and towns. But when you go down there, we actually found out that it is also deep down in the what? In the villages. And because of the screening, this screening you did, there are so many patients who were able to be identified. Now, after identifying them, remember, here when you are keeping your insulin, you keep it in a fridge. I know about 5 women there in the village. Do you know what they do? They dig a hole in the sand. That's where they keep their what? Their insulin. So, you may think it is that side, maybe there are no patients, but the patients are there and they are actually suffering more than these ones here. They don't have a fridge where to keep their drugs. They don't have, sometimes we don't have enough supply of these diabetic drugs. And I think recently we saw a communication from the Commission, the Ministry of Health, asking us to encourage these patients to make NCD patient associations. Did you receive that communication? Yes, that these patients of hypertension, diabetes, they should form their associations and then keep getting some money into the associations so that they can help themselves to what? To buy drugs when there is a stock out. But like the other person said, for HIV, for ARVs, they are free of what? Of charge. But these ones are being encouraged to form groups and buy their own what? Drugs. So you can see the dilemma we are in. So, as Kigezi region, for us, we have benefited, and now we are going to benefit again. The other day, we welcomed the Lions Club and the Mbara Eye Center here to launch a project that Dr. Runga Simon has talked about, Kigezi Eye Comprehensive what? Care. So, we shall benefit from that project as well. And we are very grateful as district leaders to be involved to this extent. I can assure you some of us were there, but we are not knowing how our patients can be helped, how we can actually strategically place or shift our health workers to make sure that the services to do with the eyes are offered in the districts. As I talk now, I'm sure most of the districts have either one clinical officer or none. Yet every health center is supposed to have one. So my colleagues at the DHOs from here, make sure you recruit. Next financial year, make sure you recruit at least an ophthalmic clinical officer to be stationed at every health center for. And I can assure you by next financial year, Bernard, when you come to my district, you'll find them all filled. And we shall try to keep advocating so that there's no one who goes blind, there's no one who gets visual impairment, yet in the midst of availability of what? Of these services. For the Ministry of Health, I think there are so many words that have been said about how this hospital has basically benefited, has grown largely out of donations, largely out of partners, development partners, but minimally from the government. And I think it's high time, since you you are in that department of eye in the ministry, honestly, the budget should be beefed up to make sure these services reach everywhere. With those few remarks, I want to once again end by thanking the Lions Club for this service beyond self, for being the mighty lions as your name reads. And before this project of Kigezi ends, I will make sure I'm going to be ambassador, that all the DHOs in Kigezi will have joined the Lions Club. Eh? And please, you are here, I've made an announcement, don't disappoint me. Yes, don't disappoint me. So, we appreciate all the services, and when we go back, I think we need to also, once again, Dr. Simon Arunga, when we come to that project, we need to be fully engaged so that we can mobilize the communities and make sure that the patients benefit, because you might bring the service, but when there is poor mobilization, then you may not realize that actually your service has been utilized. Like for this project which is closing today, I would have loved to hear the numbers, the statistics that were coming from all those districts. Then we can be said, we can be appreciated, or we can be, we can be what? or we can say that we did not do much. So with those statistics, usually they help us to know how active we have been in this kind of project. I think that's it. As we go back, we shall be trying to sing the benefits of this project and also waiting to hear from the new project. Now, allow me to take this singular honor to invite our guest of honor today to give us his words of wisdom and also to close this gathering. Thank you.
Thank you, Dr. Ryan Abdon. You have changed the things. These eyes. Yes, I wanted to ask for permission from the guest of honor to pass one or two announcements, or I can do it at the end. At the end. Thank you for the guidance.
Thank you very much, MC and my brother, the DHO, for inviting me. Just a few comments. About some time back, we were in Kaware, and I had agreed with Dr. Sevude, who is your statesman here among the DHOs in the region, that would have become a lion. Now that he's slower, but you have pledged on behalf of all the DHOs, Lion Kakuchiri, how glad I would be to be invited to be part of that function. Thank you. So you have pledged, okay? I'll wait for Kakuchiri to coordinate all of that. The representative of the Vice Chancellor, our dear District Governor 411B, the Lion Fraternity, colleagues, the media, fellow health workers, invited guests, ladies and gentlemen, allow me to welcome you here on behalf of the Minister of Health, and I bring you greetings. And we should be grateful to God for the life He gives us and the spirit of service. People have been talking about spirit of service, spirit of service. And how good it is, I had not even seen. I'm thanking God when a reverend has just come in. So that was not corruption. I had planned it. And I think what is not on the agenda, MC, is a closing prayer. So I will tactfully request the Reverend to close when I'm finishing. I'm alerting him. Exactly. Yes. Maybe who knows, he might be a lion also if he's not. He's already. Oh, okay, okay. Okay. Yes, so how would I miss that? So, but most of the issues have been talked about, so I may re-emphasize. I don't want to say I will repeat, just to re-emphasize. And I will leave out some of those which have been talked about. Just an observation, MC, I can see the current head of department, OJ, the old or previous head of department, Professor Amos, and Simon has gone. Simon, we are not short of leaders, I think, in this department. So when OJ retires, maybe the Simons will be coming. They may not actually have very long Bisanjas because the Singwires will be there. I have said it, maybe after 10 years you'll say, Stanley said it. But I've been observing, and you have a sense of humility. Now, we have talked about some of the things I wanted to talk about. Simon Arunga has already talked about closing and starting. And we are just talking about sustainability and many other things. But I think he has elaborated on that. But you realize, he said, this is a pilot, depending on performance. Then those funders will think otherwise. You know, even if you are a technical advisor, you must show that justification to the other readers who are there reading the proposal that it is worth scaling up. But I think let's really do very well so that the country benefits more. How good it would be to have so many regional projects. Now, how does the project impact on the Ministry of Health and as far as eye health and general health is concerned? First of all, I want to remind you that this project is implemented under a memorandum of understanding that the Ministry of Health has with the Lions of Uganda, which was developed some years back. And whenever there is an upcoming project now, the different lands in the different parts of the country don't have to reinvent the wheel. Just you make reference to that MOU. When time comes to amend it or otherwise, it is the Lions that can request. But so far, so good. So we are guided by that. People have talked about capacity building in terms of human resource and in terms of equipment. And we took a tour. I had actually told OJ that do I have to go? But the young man, ophthalmologist in the making, really insisted, you must come. Maybe there are some things. And indeed, when I reached there, there are about 2 other things, new innovations that I thought were new. One of the clinical rooms now, examination rooms, is now a laboratory, and you are doing that research. Very good. We need that, because now planning is about evidence. So that is very good. And the DHO you have promised in front of everyone, yes, the people who are refreshed and others trained, you know, we as public servants, we are not immune to transfers. You can be transferred. There can be attrition. But at least, wherever there are transfers, let those people who have the skills be allowed, like we have promised, to continue serving the people. And as far as eye health is concerned, you have said it, and you will know them. I don't want to emphasize what I think Lan Kakuchira had already talked about. And again, that is the good thing with doing a situation analysis. We discovered the districts that didn't have OCOs, and all the districts have OCOs. But the DHO, my brother, you have also promised that this is the time also to recruit OCOs to the health center force. I would like OJ and your team and Simon, please, follow it up with these DHOs plus myself. He has promised, and I think that's a very good one. He has promised, yes, because, and the VC's representative has clapped, because human resource is very important, very important. And the positions are there. But you know what happens? Sometimes I whisper to my colleagues, workers in the areas like ophthalmology, they will now not be taken as a priority, because they will say, we need to have more doctors, more nurses, more midwives. We need them, yes. But when you become blind, severely visually impaired, you need these people. You start now suffering it alone. So we don't have to emphasize. I think it is very easy. The structure is there. So let's have them. The good news is that also career growth is also being worked on. I don't have to go into the details. So that is how it has impacted capacity building in many areas. And we want to continue seeing. I haven't talked about because it was talked about, Dr. Uvuma Sam, the second expert in this country. Reporting. Actually, I wish we had teased out the statistics for you people, but it's now too late. I was whispering to OJ when somebody now, the DHO talked about it. We would have clearly indicated the impact it has had, this project, in as far as the figures for this region is concerned. The good thing is that I get these figures at our office, but also the region here has, and it's just clicking the computer, things have improved. They are not like the other time the Dr. Tsingiro was talking of before computer. Now things have gone much better. We just have. Actually, I have them even here on my computer. And but what I want to share with you is that we did an analysis of last year's statistics when we were having the National Prevention of Blindness Committee meeting, and DR reporting has markedly increased. Now, you may either cry or smile. Why would you cry? That means it is more of a serious condition, isn't it? But that is what the physician, Dr. Muyingo, was talking about. So it is on the increase. But do you think it is just on the increase, or it is because courtesy of the project? And I want to thank that team. Huh? They were like 5, isn't it?